So today we are going to discuss the second scenario of the rheumatology. I have some signs and symptoms of the patient and I will explain it to you, and you have to diagnose that from which condition this patient has been suffering. So let's start with the scenario. I have written it on the page. The patient is a female, 62 years old, female, presented with the chronic left knee joint pain. So it's a unilateral pain, especially involving the knee joint, and there is some inability to move the joint. You can say the patient is unable to ambulate. The pain gets worse with increased use. The patient first used the acetaminophen, that is basically the Panadol. Then the patient used the NSAIDs. And interesting point is she also had an intra-articular joint injection, which was basically hyaluronic acid injection, and physical therapy was also done. So on physical examination, the left knee effusion was present and crepitus with passive motion. So important points of the scenario are, first of all is the age of the patient, then the patient gender, that is she is a woman, 62 years old woman. Then patient had a unilateral involvement of the joint and only involving single joint, that is the left knee joint. Then patient is using NSAID and acetaminophen. This also gives some hint towards the diagnosis. And important thing that we had discussed yesterday, that in rheumatoid arthritis the pain gets resolved after doing some activity, but now the pain is getting worse. So what would be the diagnosis? I believe that you have been guessed the diagnosis. If not, let's explain the diagnosis. This is osteoarthritis, mostly occur in female, old age, involves single joint, especially the knee joint. Then the pain gets worse on doing some activity. This is very typical. If the pain gets resolved on doing activity, then it will be the rheumatoid arthritis. But now the pain is getting worse. If it is getting worse, it is the osteoarthritis. That is a degenerative disorder, and it involves basically the cartilage of the articulating joints. So the movement, or you can say the mobility of the joint, is also compromised. So what is the best initial test? We do only X-ray, and on X-ray we find that there is narrowing of the joint space, and for treatment we use the acetaminophen or we can use the NSAIDs.